Dr. Mohamed elawadi for the declare about wound management choice, please.
جميعا السلام عليكم جميعا ومساء الخير. طبعا اول حاجه احب اقولها ان انا بشكر الكوميتي ان انا ادعيت ان انا اقدر اقول كلمه على حاجه زي الووند مانجمنت تشويسز. وايه هي الووند مانجمنت تشويسز؟ ليه احنا ممكن نتكلم على حاجه زي دي؟ طبعا كلنا بنقابل clinically all kinds of wounds ايا كان ايه نوعها، venous ulcers, arterial ulcers, bed sores, diabetic foot ulcers, all kinds of wounds. تقريبا كلنا بنقابل الكلام ده in clinic wise. في حاجات كتير we could use in order ان احنا achieve the most prominent, quick and safe healing for our patients. There are a lot of options, starting with, let's say, maybe the negative pressure wound therapy. Okay, so the first item on the list today is the negative pressure wound therapy. I won't talk long about it because I have mentioned it before in several of my speeches. But let's talk about it in quick. We've got the indications for negative pressure wound therapy, starting with diabetic foot ulcers, pressure injuries, venous inefficiency ulcers, arterial inefficiency ulcers, acute wounds, chronic wounds, traumatic wounds, desiccated wounds, burns, flaps, grafts, and skin production. So it's almost covering every aspect of a wound that we could see. Why would we use negative pressure? What is the bonus? What is the addition in using negative pressure wound therapy rather than using traditional changes? Of course, for the indicated wounds, that is. First off, it does save a lot of time for our patients' recovery or our patients' healing in general. It's also a very simpler process than having a traditional change once or actually 3 times every day. We rather do that. We just do we do a negative pressure change once every 3 days, which leads to a quicker healing, a cleaner wound, and of course, the least risk of reoccurring wounds in the site, because we close the wound, zero infection, building from the underneath until it becomes back to being superficial. I won't be talking long about negative pressure. All of us around have a good idea what negative pressure does and what is Midway when it comes to negative pressure. But the part I would want to focus on is I'm sorry, there are some disclaimers. The part we will be talking about is the advanced dressings in different types. We could be talking about alginate dressings, foam dressings, hydrocolloids, silver dressings, silicone foam, and manuka honey dressings. Each one of those dressings has a specific reason, has a specific indication. It's something that we use for a certain type of wound. We could go through them in a very quick manner, or we could take 3 hours talking about them. I will just give a very quick brief about why we would use each of the listed advanced dressings. So let's start with the alginate. The alginate is well known because it's the first advanced dressings that was ever introduced to the market. It is made purely of some seaweed that is used for high absorption. It's a substitute for dressings or gauze, as it absorbs way higher ratios and it is cuttable, rather than having a dressing pad that we cannot cut through. We cannot resize it and we cannot fit it inside the wound. In addition to all that, it is bio-friendly. So even in the case of us missing a piece inside the wound, it will be absorbed by the body and it will not be causing any, foreign objects or a bigger wound because of a foreign object left inside our wound. Hydrocolloids are a perfect secondary skin we could use for protection against pressure ulcers, we could use against protection for friction, we could use for an obese patient, or we could even use for a very skinny patient with a fragile skin. We would just place it on the pressure areas, which we have 8 throughout our whole bodies. I'm sure we all know that. We use it just to prep and make sure that our patient will not develop a pressure ulcer that then will need a more complicated treatment plan that we will have to go negative pressure, as we just said. What is foam? Again, foam is one of the most old or well-known advanced dressings. Why? Because of its high absorbency rate, and it is, again, not bio-friendly, but it will absorb way more fluids than any dressing that we apply on the wound, while also maintaining a moist environment for the wound, which is the optimal area we would want our wound to be in order to heal in the optimal manner. Silicone tape or foam, again, silicone is a very commonly well-known medical item that we use, whether it comes to, whether it is in the breast implants or other kinds of implants. We could also use it on direct contact with the wound as a soft tissue or something that is a protective layer for the wound and something that organizes the granulation tissue that is coming out of the wound in order for it to heal in the most organized manner without leaving the most amount of scars. What is silver? I'm sorry about the word foam, that was added by mistake. Silver is used as an antibacterial agent. We use it to clean out wounds. We have already talked before about the foam silver that we have available in the company, but there is also a new line. I would love you all to join me in the booth to have a look at it. It's a nano silver gel, water-based, that we use as an antibacterial direct application on the wound. It has a very high concentration of nano silver. Also, in addition to that, we've got the nano silver spray, which is used as a cleaning method. Rather than using saline, we would use the nano silver spray for highly infectious wounds. That would help us eliminate the biofilm level that we have on our wounds. And let's come to the magician, Manuka honey. I honestly cannot say anything except that it's a magician. It's just one of the best autolytic debridement thing available in the whole market throughout the whole world. It's natural honey, so there is no risks. The only risk might be the absorption of the glucose into the body, which is in a very minimal percentage that does not cause an increase in the diabetes for the patient. What does the Manuka honey do? It manages the pH of the wound. It takes out all the moisture from the wound in order that killing all the bacteria available in the wound, and then also making a very good layer of granulation tissue on top of our wound. So in short, we have an advanced dressings line and then the negative pressure line covering all types of wounds throughout, starting a very acute wound or actually a stage 1 bed sore up until we could reach a chronic bed sore or a chronic diabetic foot wound. All of those are healed, all of those are sealed in an advanced manner, saving the patient time, saving the patient pain, and saving the practitioner a lot of work, whether it is to change 3 times a day or just to put a dressing and keep it on the wound for up to a week. Of course, it all depends. Each one of those has a specific amount of time we can leave on the wound, and each one of those has a specific indication that is left on the wound. Please feel free to ask me whatever questions you'd like about the previous items I've just listed. Thank you so much.